Hello everyone. Today we are learning about peripheral smear preparation and staining. The peripheral blood smear is basic and highly informative tool used in the screening, diagnosing and monitoring of the disease progression and therapeutic response. The indications of the peripheral blood smear are it is done on the clinician's request. Abnormal finding on the automated blood count. Cytopenias like anemia, leukopenia, thrombocytopenia, leukocytosis, lymphocytosis, or monocytosis, jaundice or hemolysis, identification of blood parasites, suspected myeloproliferative neoplasms, and chronic lymphoproliferative disorders, organ failures like liver failure, kidney failures, paraproteinemia, and malignancies with bone marrow involvement. The material required for the preparation of the smears are glass slides, spreader slide, pipette or capillary tube, reagents including the staining and the methanol for fixation, and if you are using the finger prick method to collect the blood, then the needle is required for the finger prick. Two methods are there for the preparing of the smear. First is a finger prick method, and the second is the blood is collected in the EDTA tube, and after collection of this blood, making of the smear within the 2 hours of the collection. This is the graphical representation of the blood collection for the thin or the thick smear by finger prick method. In this method, first select the finger. It is usually third or the fourth finger is selected. Puncture the side of the ball of the finger. Gently squeeze the finger to get the blood out. Place the slide on the top of the finger to control the amount of the blood on the slide. Mainly two types of the smears are prepared. They are thick smear and thin smear. The thick smear are made of thick layer of dehemoglobinized RBCs. The blood elements and the parasites are more concentrated in this type of the smear as compared to thin smears. They are more efficient for the detection of the parasite, but morphology may not be as good as thin smear. In malaria, parasite detection done on the thick smear and species identification is done on the thin smear. Let's learn the method of preparation of the thick smear. Place a small drop of blood in the center of the pre-cleaned labeled slide. Using the corner of another slide or an applicator stick, spread the drop in a circular pattern until it is the size of the dime. A thick smear of proper density is one which, if placed over the newsprint, allows you to barely read the words. Lay the slides flat and allow the smears to dry. Insufficient dry smears can detach from the slide during staining. Drying should be done for at least 30 minutes. Fan or hair dryer can be used for the drying. Do not fix the smear with methanol or heat. You can dip the thick smear briefly in the water to hemolyze the RBCs. The scratch method for the thick smear. It is an alternate method that allows for the improved adherence and the faster turnaround times. The process is similar, but instead of using a stick to spread the blood, the edge of the glass slide is used while applying the firm pressure to create small scratches in the underlying slide. These scratches allow for the improved adherence of the RBCs to the slide without affecting the smear morphology. Now we learn the preparation of the thin smear. First method is a wedge method. The slide should be cleaned with tissue paper for removal of excess oil or any artifact. After 8 to 10 gentle inversions of the EDTA tube, the drop of the blood is placed on the base of the slide close to the one end with the pipette or capillary tube. The spreader slide should have smooth end to prevent the irregular feathering at the tail end. The spreader slide should be placed on the base slide in front of the drop of blood, and the spreader should be moved backward to touch the drop of blood. This will make the blood to spread along the base slide width. The smear is made with the spreader slide inclined at an angle of 30 to 45 degree to blood. One should not apply the excessive pressure. The spreader is gently pushed forward in the smooth, quick motion which is resulting in the thin smear. The ideal thin smear is the length is about 2/3 of the base slide, tongue shaped or the oval feathered end, and evenly spread out smear. After the preparation, smear should be adequately air dried and label the slide with the pencil, crayon or the sticker on the head end of the slide. The another technique to prepare the thin smear is pull technique. Take a second slide and lie the edge flat on the smear slide and push the second slide back until it contacts the drop of blood and allow the blood to spread along the edge of the slide. Once the blood has spread along the edge of the second slide, then pull it away from the drop of blood firmly and swiftly. This is called the pull technique. Now we learn about the stains. The smears are stained with Romanowski stains. They are the mixture of acidic dye and the basic dye that give the different staining of the different cellular component. Different combination of the stains are available. Like Leishman stain is composed of the polychrome methylene blue and eosin. May-Grunwald Giemsa, it is also composed of methylene blue and eosin. Wright Giemsa stain, it is composed of methylene blue, azure A and eosin. This stain contains the different ratio of methylene blue as a cation positively charged basic component and the eosin as an anion negatively charged acidic component. Because of this combination, the methylene blue is positively charged, binds to negatively charged component of the cell, that is nucleus, granules of the basophil and the RNA of cytoplasm. Nucleus contains the negative charges of phosphate groups of DNA and RNA molecules. Eosin has a negative charge and so it binds to positively charged components like cytoplasm of the cells like RBC, granulocytes and the granules of the eosinophil. The intensity of the staining varies with the duration of the stain, contact time and the concentration of the stain. The smear should be stained according to the stain used. The approximate time duration is 5 to 10 minutes. Of course, this will vary according to the stain used. Let's learn little bit about the staining procedure. The thick blood films must be completely dyed before being stained, and the thin film should be fixed before the staining. Use a pasture pipette or the dip the thin film for 30 seconds into the small container or the beaker containing the methanol. Avoid the contact between thick film and the methanol, as the methanol and its vapor will quickly fix the thick film and interfere with the hemolysis of the thick film. Gently pour the stain on the top of the slide by the lying the face upward on the staining rack. the stain for 8 to 10 minutes. At the end of the staining time, remove each slide individually. Gently flush the stain from the slide by adding drops of buffered water until all stain has been washed away. Do not pour stain directly off the slide as the metallic green surface scum will stick to the film and spoiling it for microscopy. When the stain has been washed away, place the slide vertically in the drying rack. This is how the cell component look like after ideal staining procedure. RBCs look reddish pink. The lymphocyte nucleus is deep blue or violet color and cytoplasm is light blue. The neutrophil nucleus is deep blue or violet. Cytoplasm is pale pink and granules are purple to lilac. Eosinophils granules are orange to reddish in color. Basophil granules are dark blue to purple. Monocyte nucleus is deep blue or violet. Cytoplasm is pale blue or gray color. Platelet cytoplasm is pinkish and granules are dark pink or violet. Let's discuss the errors in the preparation and its consequences. First is degeneration of cellular elements seen on the smear. It is due to the delay in the preparation of the blood smear, and smear must be analyzed within 2 hours. Second is the tail end of the smear is irregular. It is due to the spreader slide edge is irregular. Take a good edge, smooth edge spreader. Third is a slide breakage or the other accident, maybe due to the applying the excessive pressure while making the smear. Fourth is a smear artifact or the poor spreading. It is due to the dirty slides, fat droplets or the poor quality slides. Always wipe the slide with the tissue paper before the making smear. Fifth is artifactual sharp refractile border in the RBC demarcating the area of the central pillar. It is due to the inadequate drying of the slide or due to the excess humidity in the atmosphere. So ensure the proper drying before the staining. Sixth is artifactual burr cells, also called the crenated RBCs with refractile borders. It is due to the improper fixation technique. Seventh is understaining of nucleus of cells. This is due to the low contact time or the low concentration of the stain. So maintain the protocol for the staining time and the concentration of the stain. Eighth is the debris and the precipitate on the smear. It is due to inadequate washing or the debris and the precipitate in the stain itself. Filter the stain with the filter paper before staining. The ninth is the excessive thick or the thin smear. This is due to the improper technique of the spreading slide. Follow the standard procedure about the smear preparation. And the last is the complete blood count and the smear mismatch. This is due to the improper labeling of the smear. It is a very important pre-analytical error and always double check before labeling the slide. These are the references for this presentation. Thank you so much for watching.